Dr. Alan Gold is with the American Society for Aesthetic Plastic Surgery. Hi, Dr. Gold. Good morning. So what's going on here? Why are so many younger and younger people opting for cosmetic surgery? Is it a case of baby boomers who just don't want to deal with aging?
Well, I don't think many of us want to deal with aging, but you're right. Plastic surgery now is being done in a younger and younger age group because we have so many more procedures to be able to deal with the early changes that you see with aging.
You know, you often hear from plastic surgeons, or the conventional wisdom is you should get things done sooner rather than later so it can be more gradual. And is that just rhetoric by plastic surgeons who want more business?
Not really. It is true that you will heal more quickly. Your tissues tend to be better. The changes that you're looking for are more subtle changes when you're younger, and now we have more limited procedures that can address those earlier changes.
Tell me a little bit about the more limited procedures where they're not quite such dramatic operations with huge, deep incisions.
Well, it's not so much that the incisions have changed, but that when you do the surgery earlier, the changes that you're looking for are less radical. So the differential that you look for in someone who's 40 is vastly different than what you look for in someone who's 60.
There's something called a short scar facelift. What is that?
Traditionally, the scars for facelift surgery were much longer and extended behind the ear, across the bone behind the ear, and into the scalp. We found now that by working on the tissues under the skin and supporting the tissues that have come down in the face with age and repositioning fat and working on the muscle, we're now able to reposition the framework of the face and don't have to pull the skin as extensively as we did, which avoids a lot of that windblown look or overdone look. And we can do it now with smaller incisions. That's one of the goal of our surgeries. But still, you must understand that it's not the surgical technique that's so critical, it's the surgeon that's performing it.
And how do you find the best plastic surgeon if you're opting for cosmetic surgery?
There are a lot of people out there doing cosmetic surgery. Not all of them are plastic surgeons. And although I'm here in New York and you've just seen physicians who are in California, there are very well-trained, board-certified, excellent plastic surgeons across the country. If you call the American Society for Aesthetic Plastic Surgery referral line, it's 1-888-272-7711, or pull up their website at surgery.org, you'll find a listing of those plastic surgeons in your area who are members of that organization.
Because it's interesting that doctors who are in other fields are now going into plastic surgery because it is so lucrative and there's such a big demand.
Right, and some who are well-trained and some who are not well-trained. And you need to be an educated patient when you seek plastic surgery.
Why has there been a 55% increase in eyelid surgeries in the last 5 years, do you think?
I think that a lot of it may have to do with the baby boomer generation, just getting into that age group in which you begin to see changes around your eyes. It's always said that the eyes are the window of the soul, and when you make eye contact with someone, the appearance around their eyes tells you a lot about how they feel, how they're interacting with you. And I think that as people begin to see those changes now, even early on, they know that there are things that we can do surgically to address those.
Once you start down this road, is it hard to stop? You hear about people who get addicted to plastic surgery and can't get procedure after procedure after procedure. Do you have to be mindful of that when you start on this journey for a more youthful appearance?
Well, if you're a reputable plastic surgeon, then hopefully you'll prevent patients from doing that. But if it's done well, elective cosmetic surgery can make a profound difference in your life, and a very positive one. But again, you need to be cautious about who it is that you see and be sure that you're going to someone who's skillful enough to give you the changes that you want.
And take a good look at why you're doing it and the real effects, because it doesn't necessarily change your life and make you a happier person.
Well, it can. But it won't change,
going to say that.
But it won't change who you are.
All right, Dr. Alan Gold. Dr. Gold, thanks very much for coming in.
Thank you very much.
Appreciate it.